Effie O'Neill Ellis, born 1913, died 1994, African-American physician. A specialist in maternal, prenatal, postnatal, and preventive health care, Effie O'Neill Ellis was the first black woman administrator in the American Medical Association. She dedicated her career to treating and advising new and expectant mothers. An equally important contribution to public health was her determination to encourage health maintenance throughout life at all socioeconomic levels. Ellis was born in Hawkinsville, Georgia, on June 15, 1913. Her parents were Joshua P. O'Neill, a home builder, and Althea Hamilton O'Neill. Ellis excelled in academics. She received her bachelor's degree in biology and chemistry from Spelman University in 1933. She then earned a master's degree in biology from Atlanta University in 1935, the same year she married Arthur W. Ellis. She planned to continue her research in parasitology, and in recognition of O'Neill's capable research, Atlanta University awarded her a grant to investigate parasites and disease in Puerto Rico. Her experience in Puerto Rico changed the direction of her career. Struck by the limited access that poor people had to medical care, she resolved to become a medical practitioner. She entered the Illinois College of Medicine, graduating 5th in her class of 160 on June 16, 1950. After an internship at the University of Illinois Hospital and a residency in pediatrics at Massachusetts General Hospital, Ellis served a postdoctoral fellowship in pediatric cardiology at Johns Hopkins University, 1952 to 1953. On March 23, 1953, she married James Solomon, who was also a physician. They had one daughter, Elaine. From 1953 to 1961, Ellis served as pediatrician and director of medical education at Baltimore's Providence Hospital. In 1961, she became director of maternal and child health for the Ohio State Department of Health, where she remained until 1965. From 1965 to 1967, Ellis served on the Ohio Commission for Mental Health and Mental Retardation Planning. During this period, she became the first regional commissioner for social and rehabilitation service in the Department of Health, Education, and Welfare. Ellis resolved to increase the scope of family planning education, particularly among the poor. Apart from contraception, she encouraged the development of adequate nutritional and sanitary conditions to meet the growth and development needs of children, beginning in the prenatal stage. She chaired a panel at the White House Conference on Food and Nutrition in 1969. In 1970, Ellis became the first black woman administrator of the American Medical Association. It was in this capacity that she influenced the formation of the first National Congress on the Quality of Life. As Special Assistant for Health Services, she traveled the United States extensively speaking to promote public awareness of family health, sanitation, and prenatal care. Ellis also developed parenting programs and procedures for the March of Dimes. Ellis was a member of the National Association for Maternal and Child Health, the American Public Health Association, the American Public Welfare Association, and the American Association on Mental Deficiency. She was also a member of Alpha Omega Alpha and Delta Sigma Theta sorority. In 1970, she received the American Academy of Achievement's Golden Plate Award and the Trailblazer Award from the American Medical Association. Ellis was inducted into the Chicago Hall of Fame in 1989. Ellis died of cancer at age 81 on July 5, 1994, at Northwestern Memorial Hospital in Chicago. In an obituary, Jet Magazine quoted Ellis' definition of the quality of life as, quote, good health, good interpersonal relationships, appropriate values, the opportunity to learn what you want to learn, and to work at what you wish to work at, unquote. Citations are in the description.